Good afternoon, and welcome to DHEC's COVID-19 Media Briefing. I'm Christy Moore, Chief Communications Officer here at DHEC, and joining us today is Dr. Brandon Traxler, DHEC's Public Health Director. Dr. Traxler will first share an update on COVID-19 in South Carolina, followed by answering questions that were submitted, and will also reserve some time near the end of the briefing for live Q&A. So Dr. Traxler, if you're ready, we are ready to hear today's update.
Thank you, Christy, and thank you, and good afternoon, everyone. I appreciate you all attending today's briefing. I want to start by highlighting the numbers that we reported a short while ago, earlier today. Nearly 6,000 cases. South Carolina reported nearly 6,000 people in our state have been diagnosed with COVID-19 in one day's time. And while we cannot confirm a number just yet, early data is showing that we will eclipse that mark in tomorrow's report, and we'll likely see these soaring numbers in the days and weeks following New Year's Eve and day. This is no time to mince words. This is flat out alarming for our state. We recognize at this point that people are numb to the data, but these stats aren't simply numbers. They represent people. They represent people who are our family members, our friends, and our loved ones who are sick, who are hospitalized, and unfortunately, some of whom are dying from this disease. We recognize that many people have already inked their New Year's plans, but given these high case counts and what will happen if a collective change isn't made, we urge everyone across our state to strongly consider the dire times that we are in. Please find a safe alternative to joining large crowds or groups of people for New Year's Eve. Meeting for virtual toasts and meals, playing music over a video message, or even gathering, together on as a neighborhood countdown, virtually, or even where everybody goes to their front door or their porch and celebrates from afar with each other, are some good ways to safely ring in the new year. We know that this is not ideal, but neither are the times that we're all living in. The unfortunate truth is that sacrifices will be made one way or the other. They'll either be made willingly by finding alternative ways to celebrate, as well as getting a safe and free vaccination and masking up, or we'll be forced to make the ultimate sacrifice by watching more of us suffer from those severe cases of COVID-19. And I know that we have said this before, but it still rings true. We're at a crucial moment in the pandemic. We do not want to start 2022, our third year of COVID-19, with record numbers of hospitalizations and deaths. But we're unfortunately headed in that direction if we don't change things. As dire as these times are, we have the power, each one of us, to reverse that course and change how our lives will look in the near and the distant future. It starts by staying safe today and through this upcoming weekend. But that's not all. We know that the Omicron variant is spreading all throughout our state. But we also know that a full vaccination series, which DHEC now considers to be that initial vaccination series and ideally a booster shot for those who are eligible, ages 16 and up currently, will stave off cases of severe disease and all of the variants of COVID-19. So we urge our residents not to waste time. Protect yourselves and your families against this deadly virus and the variants. It's easy to look at these big numbers from a statewide perspective. What's not easy is being one of the people who is breathing with the help of a ventilator, a machine forcing air through a small tube into your lungs, or being a loved one who is sitting in a waiting room or beside a bed praying that their family member will recover from a severe case, or being one of those unfortunate family members who has to hear the ultimate bad news from a healthcare professional that they've lost somebody near and dear to them and will never get to see them again. We need to unite together as a state to protect each other and to protect our great state. Ring in the new year with a renewed commitment to your health and to the health of others. Please consider staying home for the New Year's Eve celebrations so COVID-19 can't impact you and the people that you love. Thank you.
We appreciate that update, Dr. Traxler. Now let's get to our questions. Sports teams, especially the pro ranks, frequently require their players to be tested. As of late, three of the major sports are finding positive tests for numbers of players that in some instances approach half of their rosters. Do you think exponentially that there would be similar results if the general population were to be tested every few days?
So that is difficult to say. It's safe to assume that there are many people who are COVID-19 positive who have no symptoms or have very mild symptoms, especially people who are fully vaccinated and boosted in the era of Omicron. And so those are potentially likely not getting tested, many of those people. And it's fair to say, I think, therefore, that we would see potentially significantly more positive tests if more people were getting tested on a regular basis for screening purposes. But how many more we would see is very difficult and close to impossible to project.
CDC has released a number of new recommendations, including cutting in half the isolation for infected Americans to 5 days. How is DHEC revising recommendations, especially in the light of the U.S. hitting a record for the average number of new cases?
So, for starters, we encourage those who test positive for COVID-19 to isolate, regardless of your vaccination status, and stay home and avoid in-person contact for 5 days at a minimum, everyone who tests positive. If you have no symptoms after day 5, regardless of your vaccination status, you can end your isolation, but you must wear a mask when you're around others for 5 more days. If you were exposed as a close contact and are vaccinated with the initial vaccination series and a booster for those who are 16 and up, you do not have to quarantine, but we do recommend that you mask for the 10 days and we do recommend that you get tested on day 5. If you are not vaccinated or have received some of your vaccines, but not your booster, you should quarantine for 5 days. We recommend getting tested on day 5 and wearing your mask for another 5 days when you're around other people. We do have special guidance, the CDC, that we've adopted that the CDC put out for healthcare facilities who are experiencing staffing shortages. So the exposed workers who have not received the vaccine, including a booster when eligible, so if they've not received all of the vaccines for which they're eligible, may wear a mask still, though, for 10 days if a quarantine is not feasible with maintaining patient care due to the staffing shortages, so long as they test negative and do not have symptoms. And again, that's for healthcare facilities, for healthcare workers in these critical staffing shortages. That should be a last resort option when staffing cannot be maintained any other way. And lastly, we do support the CDC's guidance they released about a week before Christmas on test to stay option for schools, which includes vaccination for those who are eligible, which at this point is ages 5 and up, so everybody in K-12 schools, masking for ages 2 and up, and increased testing. And so this involves extra testing to keep kids in school to avoid quarantine if they're a close contact. We recognize and are aware that the availability of the rapid tests and adequate staffing to administer them will be challenging, and we are working with schools to address this to the fullest extent of our abilities.
Thank you. How does DHEC recommend that people self-report their positive COVID-19 at-home test to the health agency? And does DHEC expect to have an inaccurate number of positive cases due to some people not self-reporting their at-home test?
So per the South Carolina list of reportable conditions, positive COVID-19 home tests are not reportable to DHEC since these tests are not conducted or supervised by a healthcare provider. Only tests that are performed in a lab or by a provider, a healthcare worker, are reportable, which is common in many, if not most, other states as well. So that said, the home tests do serve a vital role in people's efforts to identify positive cases early so that they can isolate and not expose others. or when they cannot or decide not to visit a physician or other healthcare provider. So these home tests, which are not reportable, will result in case counts that we report out likely being underreported. But the trade-off of more people knowing they're positive and knowing to take action is worth it.
And this is several questions in one, so bear with me. What are the latest numbers and trends for COVID-19 hospitalizations in our state? How is the current surge affecting hospitals in terms of patients and staffing? Are the hospitals being overwhelmed? And can you provide details about specific hospitals in the upstate or anywhere else in the state?
So looking at our hospital data dashboard, we do unfortunately have 783 individuals who are hospitalized with COVID-19 in the state, which is up 42.4% compared to last week. There are also 85 patients who are COVID-19 positive who are on ventilators, and that's 9% higher than it was a week ago. There are 188 of the patients who are hospitalized are in the intensive care unit, and that is 10.6% higher than last week. We have had 146 new COVID-19 admissions across the state, which is 102.8% higher than last week. We are in frequent communication with the South Carolina Hospital Association and are monitoring the situation in the hospitals very closely. As far as how it's impacting hospitals, particularly any specific ones, I don't want to speak for them, so the hospitals themselves or the hospital association would probably best be able to answer those questions. But we do remain in close communication with them and are monitoring the numbers very closely.
Thank you, Dr. Traxler. And that was our last pre-submitted question. So at this time, I'm going to open it up for live Q&A for members of the media. If you will please just shoot up your little yellow virtual hand. Simon Williams, you're the first one I see. Go ahead and ask your one question.
Hi, Dr. Traxler. I know you mentioned briefly there about working with schools for testing, but I also know that there was a tweet sent out by DHEC today about higher than normal call volumes for testing and results possibly, planning for results to take a little bit longer. Is there anything that you can share moving forward to help, I guess, navigate increase in test in South Carolina?
Sure. And so I think those are two separate entities. There's certainly testing, as you brought up initially, with schools, with the K-12 schools, which have some special programs. And then there is the testing that's for all the rest of us in the state. And so there are some special programs. When I mentioned earlier, working with the school districts and Department of Education, there have been 3 different testing programs. We've worked with them all year on. One being just connecting them with the federal testing option, and then certainly testing vendors that I know many of them have taken advantage of, and then also the rapid tests. And so when looking at the test to stay programs to help avoid any quarantine potentially, that is where we are working with schools and school districts to get them the rapid tests they would need if they're going to implement that to the fullest extent of our abilities. Recognizing that rapid tests are in short supply nationwide. And then in terms of the general public, yes, we are seeing significant amounts of testing being done. I want to commend South Carolinians for that and say thank you for them going and getting tested, taking that time, for them being patient when they are having to wait in long lines or having to wait for their results. We are working with not only our own testing sites, but with all of our staff, our vendors that are doing testing for us to rapidly increase the staff, as well as trying to even just do things like improve traffic flow patterns and such. And we are certainly working with labs, to make sure that the turnaround times remain reasonable. I do want to remind people that our testing results call line is for people who have gone 72 hours or more without getting their results since they were tested. We've seen a sharp influx of people who are calling in much shorter time frames than that, looking for their test results. And when the PCR tests are done, we're still looking at that 24 or 48 hour turnaround time. They're not rapid tests. And so we ask that that people wait till 72 hours to reach out to us. But we are doing everything we can to increase testing for all groups and people in the state, and congratulate those who recognize the importance of getting tested and continue to encourage patients.
Devyani?
Hi, good afternoon, Dr. Traxler. We are in year 3, almost entering year 3 of the pandemic. Do you think that the state's response has been more reactive than proactive in dealing with the pandemic?
I think there have certainly been aspects of it where we have been more reactive than proactive. And there are certainly many things that many different people and groups and all of us could have done differently, be it local, state, federal, national, international, worldwide. But I will say that in terms of things that we have been reactive to, I have to remind myself that sometimes that is inevitable because this is a new virus. This is something that is rapidly evolving. And while we do our absolute best, and I think do a good job at being able to look a little ways down the road in terms of envisioning what might be coming, we cannot predict every twist and turn on the road. And so there are times when everybody has to be reactive because there's no other option.
Thank you.
Taggart?
Hey, Dr. Traxler. We have been hearing of course, some breakthrough cases when it comes to the Omicron variant. Is it best for people as far as protection to get the booster? Is that seeming to be the most effective way to at least avoid getting that variant, or at least minimizing, illness from that?
Absolutely. Absolutely. We have seen through both lab results in the sense of studies that are conducted on a laboratory bench, as well as real world data from other parts of the world, and then now even other parts of the United States that have experienced the Omicron surge earlier than South Carolina. We have seen that getting the booster is if you're looking at one thing that could best help you, it is being fully vaccinated with the initial vaccination series, and when you're eligible, that booster. It means that for many people then who acquire Omicron, even if they are getting it as a breakthrough case, they are getting very mild at most moderate symptoms. So it is keeping this for many people who get infected down to cold or flu-like symptoms, as opposed to something that could require hospitalization or death. And I would say the second most important thing people can do is avoiding big crowds and wearing a mask anytime you're around other people, and wearing a good quality mask. CDC has recently said with Omicron, it's even more important to make sure that you're wearing a good quality one.
Kirk, you've got a question?
Yeah, Dr. Traxler, I just wanted to go over the hospitalization numbers that you just gave. They're a little different than what are on the DHEC website from 12/29, right before midnight last night. Are your numbers from last night, or are they current as of today?
I pulled my numbers yesterday afternoon when we got that question, so I suspect they might be a little different.
Okay, very good. Thank you.
Mm-hmm. And my apologies that I haven't had time to update them.
Mr. Wong?
Hi, Dr. Traxler. I have a question. So seeing this surge right now, are you concerned with students going back to school next week will result in some type of surge like we saw back in August for many school districts? And if so, what do you recommend school districts to do? Should they impose a temporary 14-day mask mandate? Should they go virtual for 14 days just until, the holiday travel surge dies down?
So I am concerned that we could potentially be seeing more of a surge in the next couple of weeks, more so related to we're experiencing the holidays effect at the same time that Omicron is really hitting its acceleration in our state. And so that being said, we know that children need to be in person in school for multiple reasons. And so I do think that putting kids back in school can be done safely. We know that all students and staff in schools now are eligible for vaccination, 5 and up. And so I really strongly encourage all staff and all parents of children to please get them vaccinated. This is the time. We still have a lot of winter left to go. And we know that the vaccination and for staff that are eligible, a booster is the best protection against Omicron. And then secondly, I certainly encourage masking. for people to choose to mask, even if they're not finishing quarantine or isolation and returning early.
Denny Lynn?
Hi, Dr. T. First of all, I'm betting I'm talking for everybody in this room at the moment. Thank you. Thank Dr. Bell. I see her lurking there. Thank Dr. Kelly, Christy, Derek, all of you for your consistent contact and updates, and the fact that you have always helped us for the past however long. We can't tell you how much we appreciate you.
Thank you.
Okay, now the question. Yesterday, Governor Kemp over here in Georgia came out with some more money for the hospital, National Guard. Has DHEC been talking with the governor, gotten any kind of indication from the governor, might be considering something similar to ramp up assistance in Carolina?
And so I will just say that we, as well as the Emergency Management Division, the National Guard, the Hospital Association, and the Governor's Office all remained in very frequent communication, even throughout December and the holidays, and will continue to do so going forward. And so I am not aware of specific discussions, that you're talking about, the specifics that Governor Kemp did in Georgia. But we are continuing, as I said, to monitor the hospital situation, and we'll continue to look and see whether those sorts of things become needed. At this time, I don't think they are. We have not had an indication that they are in South Carolina, but like I said, we're all staying in very frequent communication.
Damien?
Yes, thank you and good afternoon. Wanted to ask, how do you kind of explain a change in recommendations that seems to reduce the amount of time spent in isolation or in quarantine for people who are sick at a time where we seem to be having a huge surge of cases?
Sure, and that comes based off of science that's really been building since earlier on in the pandemic, but has become even more noticeable, I'd say, this data during Omicron, and that is that people are most contagious initially during their infection. So we have good data, and the CDC has collected good data that, as well as worldwide, that the first those couple of days before you develop symptoms, when you first become contagious, and you might not even know it, and then those first 2 to 3 days after your symptoms begin, that kind of 5-day window is where you are the most likely to be the most contagious. And so looking statistically, even though cases are going up, that is the period of time when most transmission's occurring. And so if we can do isolation and quarantine during those times, it will drive down transmission.
Simon, you've got another question?
Thank you.
Yeah, just one more about the, I guess, early evidence. I was wondering if you could say anything to address the flawed thinking of, we're seeing a lot of people, say, well, early evidence shows that it's mild, or that Omicron cases are mild illness. I guess my question is if there's anything that you can say to A, address that that's very early evidence, and B, that mild can still be very effective or even detrimental in some cases.
Certainly. So the early data, it is early, it is preliminary, as we like to say, it's preliminary and subject to change. A lot of it's coming from communities that are not South Carolina, that are coming even a lot of times internationally. And so it can be hard to compare when, the United Kingdom is not just like South Carolina in every other regard. So while a lot of their illnesses are mild, that might not be the case in South Carolina. One of the things you have to look at are vaccination rates and vaccinations. And so it could be that because there are so many more cases just total of Omicron, we know that more of them are going to be among vaccinated people than previously. And those are the ones that are going to have the mild to moderate illness. So I don't think we have the data yet to say that with confidence that it is only causing mild illness in people who are not vaccinated with that initial vaccination series and boosted when eligible. So I think the jury is very much still out as to whether that would carry over to that subpopulation. And second, certainly when we see large numbers of cases, even if a lot of them are mild or moderate, you still, based on sheer volume, are going to have a higher number of severe cases. And that can overwhelm hospitals. It can also overwhelm outpatient doctors' offices and clinics, emergency departments. And so just the volume alone can be just as much of a stressor on our healthcare systems.
Thank you for that, Dr. Traxler. We still have a few minutes. I don't see any virtual hands. Anyone else have a question for Dr. Traxler for today?
I do have one more question. Taggart Hauk from WYFF. Dr. Traxler, it has been described to me, at least by health official at Prisma, that the increase in cases we are seeing right now is kind of the product of like 3 separate surges, combining into one. And what they have told me is basically you've got people who are vaccinated who are getting the Omicron, you've got the unvaccinated getting Delta, and you have unvaccinated getting severe cases of Omicron as well. So is that kind of, I mean, would you agree with that assessment of kind of where we're at with the increase?
I think that is a fair hypothesis. Knowing that the sequencing takes a while, and so those results often lag a week or two behind what's really occurring, and knowing how rapidly this all is evolving and Omicron is spreading, I do think that at this exact moment there is not only Omicron in our state. While it is significantly increasing and becoming the dominant one, there is still Delta variant out there, and so I think that seeing a mixture of both affecting people and the results that both can cause is absolutely a fair assessment.
Thank you.
Thanks, Taggart. Are there any other questions for Dr. Traxler? Okay, well, I don't hear any. Oh, Danny Lynn, did you have something?
No, I was just going to yell, stay safe, everybody, and Happy New Year.
Thank you for that. I just
Thing up for you.
thank you all for joining us today and for helping us keep South Carolinians healthy and safe. And that does conclude today's briefing. Thank you.
Bye, everyone.
Have a happy new year.